Ingrams, you said in your speech earlier today that you were going to be leaving your practice. Do you want to just say a bit about why you're doing that, why it's come to that?
I come to it with a very heavy heart, and I mean, unfortunately, general practice, working longer and harder, and the rewards are getting less. So in my practice, like an awful lot of my colleagues working in inner city practice, no working 12-hour days. That's normal as a minimum. Don't get breaks anymore. You don't get time to sort patients out. You don't get time to reflect on the service that you're giving. So patients are really getting a poor service now. And as much as I've got so much brought into my practice, since 2003, I've been running the practice. I've been developing it. So to get to a point where I'm thinking, I've got to go because I can no longer provide a service to patients and it's affecting my health. I need to be out there.
What would have need to have been done differently for you to remain in the practice? What kind of policies would change the situation?
Well, practices are really suffering from a triple whammy. Problems with workforce, problems with workload and funding. The workforce would sort itself out if they sorted out the workload and the funding. General practice has just been starved of investment. Not only just direct money into the service, but funding to support practices to work has gone. It's no longer there. And then in terms of workload, there could be an awful lot done to reduce how much general practice does. Everyone thinks that general practice is the last resort. Every bit of work that no one else wants to do, everyone just assumes general practice will pick up. And that's got to end. It's got to end things like CQC. It's so bureaucratic. We have been threatened to be CQC'd on 2 occasions. We're told it's going to be within the next month. So you spend ages, hours, having special meetings, counselling, even a counselling appointment, so you can have meetings together to prepare for it. And then it doesn't happen. It almost would have been easier if it had happened first time, because at least we wouldn't have done it. But we've now been through that process twice, and now we've been told it could be any time. So you continue spending lots of time keeping up to date, keeping up to date, which actually don't affect patients at all. It doesn't improve patient care. It doesn't improve the practice.